Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Hi, welcome to Redefining Medicine. We're in Boston, and we have an amazing turnout. I'm really excited. A4M, bravo. Peptides, bravo. And the other thing that is really important is that I have Dr. Tara Scott with us, who just finished her talk on BHRT. So, Dr. Tara, tell us about your talk and tell us about your passion in medicine.
Well, thank you. So I am a traditionally trained OBGYN. So I came up, delivering babies and doing the traditional thing, and then really kind of saw a little gap in education because we're really not given any education on menopause, on hormones. Whether we are taught how to get someone pregnant, deliver the baby. I could cut a baby out in a minute in a C-section. But then, like you said, after postpartum, what's the transition to care? So my own personal journey was, I had infertility. I had to take a lot of drugs to get the kids that I do. So through those ups and downs of hormones, then after I was done getting pregnant, there was no solution. I was too young to be menopausal, but I still had a hormone imbalance. So I started just looking for education and found, this was 20 plus years ago, and then found some education in hormones, and until about 12 years ago started in the fellowship. So I was here, probably listening to you lecture as well, learning as much as I could. And first it was just female hormones, and then the more you learn, you realize the less you know, right? Then you got to learn about thyroid and adrenal and gut and brain and all that stuff. So I think I'm happy to be part of the faculty because I kind of bring a traditional evidence-based part of it because, that was hammered into our heads. And 1 foot in the door, 1 foot out the door, I can say, here's what our colleagues are saying, but here's how I interpret that. So here's what the studies are saying. This is valid because this is not valid. You have to look at this. What did they study? So I think that most participants can appreciate being able to interpret the literature and go to their traditional colleagues and say, hey, this is why I do what I do.
That's amazing. And you know what? You summarized it, because the truth is that we know a lot less than we think we know. Yeah. In traditional medicine, we don't tell that. So I think it's about time to start telling the truth. And what you've done is what any intelligent, thoughtful, caring doctor would do, which is actually question the status quo and start looking elsewhere for answers. And like you, I didn't start with A4M because A4M had just formed when I came to be. But I looked at the patients and I wanted the patients to be okay. And there were no answers. So I think having OBGYNs who are conventionally trained, who realize that there is such a paucity of information and time that needs to be addressed. There's no specialty, like I was saying this morning. There's no specialty for women between the time when they're postpartum to menopause.
Right.
What do you do?
Yes, I get a lot of people messaging me on social, and now we have social media and internet now, right? So patients can get so much more information than they could 20 years ago.
Thank God.
So we get good and bad, right? So I get a lot of inquiries about who do I go to? Do I go to my PCP? Do I go to my GYN? My GYN refused to order anything, or my GYN ordered and said it was fine. And then, you ask them, well, when did they tell you to get the hormones wrong? Oh, I don't know, anytime. Or there was not a science. There's some that are open and willing, but they don't have the tools and the education, exactly. Right? And then there's some that, if it's not, like they say it is, I'm not going to do it. I'm not going to check hormones. So-and-so says ACOG says don't check hormones. So I'm not going to do that until you're menopausal. So like you said, there's this gap in care. But there's so many women who are suffering and looking for providers to help them.
Yes, and thank God now we have providers like you to help them, and I'm still around. Yeah. So there are a lot of us, and there are a lot of people who want to learn, and we're here to teach them. What is your passion?
There's a couple of things. I mean, one of my passion is sticking to the science, to making sure everyone's equipped to go and know why they're doing what they're doing. So that's part of it. But I also have a really heart for patients with breast cancer. and really heart disease. I mean, 15 years ago, my brother died at 38 of a heart attack. He had every risk factor. He was a smoker, he was a diabetic, he was at a statin, he was a lawyer, he was stressed. It was completely preventable. And so I think that made me look at medicine a little bit differently. To traditional medicine, he was normal, right? And so I feel that in the hormone segue, we're not doing a good enough job preventing breast cancer. And I think there's this stigma, don't take hormones. But there are some women who have a higher risk of breast cancer not taking hormones that are estrogen dominant, right? And they're afraid to take any hormone, or there are these patients who have had breast cancer who are suffering. I have patients in my practice that are 10 years post-cancer and not even 52 yet, and they're suffering. So, the castration of women, right? So
exactly right.
I think I was actually lucky enough to get a poster accepted at the North American Menopause Society meeting next month, which is huge because they're very traditional, right? It got rejected initially because I had like SNPs and estrogen detoxification, so I had to take out that and just make it, let's check estrogen endogenous levels and exogenous levels in breast cancer. So then they accepted it. So it's like there is a lot of data out there, and I think there's a re-education. So in that traditional counterpart, I'm just trying to say, let's check the hormones. Let's address the hormones. Okay, maybe you don't want to do a dried urine test. Maybe you don't want to do saliva, but let's agree that there is something instead of nothing.
You're right. And it's interesting because, as I was saying before, that 2022 was the first time the North American Menopause Society actually had an opinion come out after the last time was 7 years ago. 7 years ago. And they're saying that now we all agree that hormone treatment is the treatment of choice. However, it's only if there are no contraindications. And they have 1,000, it's words. And we're talking with patients. We're not talking to words. We're talking to patients. And what you're doing is amazing because you get that. And I think what we're trying to get across in redefining medicine, in making A4M the resource for learning the way to practice medicine in the 21st century in a way that actually keeps people healthy.
Right.
And like you said, we're all conventionally trained. And the reason we kind of strayed is because the answers weren't there. And some of the answers are still not there.
And one of the things I can appreciate from this course, I've done other courses otherwhere, and the amount, there's a couple things. One, the amount of evidence, and two is the practical tools that when you leave here, you'll be able to implement it clinically.
Correct.
Like you can go and be like, okay, wait, now how do I start someone on a hormone? What do I do? So at the end of this course, they're going to get exactly like how I consent patient, what are the dosages that we use, and how to start so that they're not nervous. We're so scared as a traditional provider, scared to get sued, scared to get I don't know what, but you have to have the tools and a heart to listen to the patients, because like you said, every patient is different. You have to personalize medicine, and you can't just have blanket protocols for everybody.
I agree 100%. I couldn't agree more. And I feel honored to be able to interview you, to talk to you, because all these people need the answers. And it's not just the doctors, the providers that need the answers, it's the patients. And I remember when I started in 2002, people would come to me and they would take hormones from me and they wouldn't tell their OBGYNs because they were afraid.
Yeah.
Or like you said, or you would have the doctor say, you shouldn't be taking this, it's going to cause cancer. They still do it.
They still do
They
that.
still do it.
Right.
And it's based not on science. What you said is so important. What we teach is based on science. But we're also teaching the truth. And the truth is that we don't know as much as we think we do. And that what you need and what we have to offer is the information, our experience, and the data that will help you start taking care of your patients tomorrow.
Right. I have a patient that was a high-level executive, and she went back to New Jersey for this high-level executive medicine, and I had started her on testosterone, estrogen, progesterone, and they said, well, I'm not sure you should come back here if you're going to take that.
Yeah. Isn't that, I've heard that too.
Yes.
I've heard that too. It's sad. And you know what? Because it's a system that's based on fear, and you're getting the patient to do stuff because they're afraid. And then you're afraid, like you said, for whatever reasons, because we're indoctrinated to do things one way or another. And so it's all about fear. What we're creating is a system of empowerment, where you are making decisions because you care and you're working together as a patient advocate with the patient. And the patient does well, and it's amazing, and it's so rewarding. And sometimes they say it's magical. It's not magical. It's really based on real facts.
And the doctors who are attending want to help their patients. And
Right.
they know that the typical patient that's coming in is a 47-year-old female who's then going to bring her husband and her daughter
Exactly.
into this if you help her.
Right.
And so being able to address these complaints is important for your practice as well, because like you said, you probably have word of mouth and people coming in, and that way you're helping one person individually, but then you're helping, a whole system.
Right. So we want you to listen to us, to come here, to share your information with us, to share your knowledge with us, and tell us what you need, because Dr. Scott and myself, among the other 100 faculty members, are here to help make your life and the patient's life better. Thank you so much for coming and sharing the information with us
And
today.
thank you for the
Thank
podcast.
you. Thank you.